Hai, Assalamualaikum. Hari ini kita akan bentangkan pasal pharmaceutics, cardiovascular dan hematopoietic system. Introduction. Cardiovascular system. This system is also known as the circulatory system. It includes the heart, blood vessel like arteries, veins and capillaries, and blood. The main job of the cardiovascular system is to pump and circulate blood throughout the body. This helps deliver oxygen and nutrients to cells and remove waste products like carbon dioxide. The heart acts as a pump to move the blood, white blood vessel act as the pathway for blood flow. Hematopoietic system. The system is responsible for producing blood cells. It mainly takes place in the bone marrow, which is a soft tissue found inside bone. There are the three main types of blood cells created in the hematopoietic system. First, red blood cell which carry oxygen. White blood cell which fight infection. Platelets which help with blood clotting. In summary, the cardiovascular system circulates blood. The hematopoietic system produces blood cells. Both systems work together to maintain a healthy body by ensuring that all cells get the oxygen and nutrients that they need, while also need infection and clotting blood when necessary.
So I'm going to present one of the drugs that can treat cardiovascular and hematopoietic system. First, we got aspirin. The indication is to prevent of thrombotic complications following coronary artery bypass, graft surgery, secondary prevention of cardiovascular disease, secondary prevention of thrombotic cerebrovascular disease. So basically aspirin ni dia punya indication untuk mencairkan darah yang beku lah. So the active ingredient of aspirin is aspirin itself, and the dosage for adult long-term use 75 to 150 mg once daily. Doses up, it can be for short-term use. It also can be for short-term use. Doses up to 300 mg daily may be necessary for some circumstances, and no dosage for child. That's all.
Inactive ingredients. 1. Starch, act as a binder and filler. 2. Calcium carbonate, as an antacid to help reduce heartburn and upset stomach. Commercial packaging, available strength 500 mg, 325 mg. Boxes contains multiple blister pack or a bottle depending on the brand. Information on the box includes brand name, dosage 325 mg and tablet count 100 tablets. Important details like expiration date, manufacturing date and batch number, instruction for use, storage details and safety warnings. Yang kedua, blister pack or bottle made of aluminium and plastic for blister packs or plastic for bottle. Each tablet is separately packaged in blister pack to ensure freshness and prevent contamination. Bottles usually have a chill resistant cap. Yang ketiga, label. Brand name and dosage prominently displayed. Ingredients list and any allergen information, direction for use and dosage instruction, warnings about possible side effect and interactions with other medication, manufacturer's information and contact detail. These elements help ensure safety, compliance with regulation and user convenience.
Norvex. What is the indication of Norvex or use? First line treatment of HTN and myocardial ischemia with a due to fixed obstruction, stable angina. Monotherapy or in combination with other antigenal drug in patient with angina refractory to nitrates and or B blockers. Dosage or duration of use Norvex. HT and angina initially 5 mg once daily may be increased to max 10 mg. HTN children and adolescents 6 to 70 years old initially 2.5 mg once daily may be up titrate to 5 mg once daily.
Okay, the active ingredient of Norvex is amlodipine bacillate, and the inactive ingredients is microcrystalline cellulose. The function is a non-caloric fat replacer, concentration 60% to 70%. Second, the inactive ingredients is sodium starch glycolate. The function is to promote rapid disintegration and dissolution of IR solid dosage forms. Concentration is 2 to 8% of the prescription amount. Third, anhydrous calcium hydrogen phosphate. The function is an excellent source of calcium and phosphorus, essential minerals for maintaining strong bonds and teeth. Concentration 6 to 10%. The last, magnesium stearate. The function is as a lubricant, which is a reduced friction between surface in mutual contacts. Concentration is 0.25 to 5% weight per week. Alright, this is example for the Norvex, which is ada dua dia punya strength. Kita ada Norvex tablet 10mg and 5mg. Alright, that's all.
Okay, hello, my name is Irfan. So today I will be presenting to you about Abaten atenolol. Okay, for indication and use, Abaten is indicate for the management of hypertension, management of angina pectoris, management of cardiac arrhythmias, and management of myocardial infarction. So early intervention in the acute phase. For overdosage, the symptoms of overdosage may include bradycardia, hypotension, acute cardia insufficiency, and bronchospasms. For active ingredient is atenolol itself, and then for inactive ingredient maize starch, lactose, polyvidone, sodium lauryl sulfate, colloidal silicon dioxide, magnesium stearate. So for administration may be taken with or without food.
Hi, my name is Nur Balkis Alia. I would like to present about atenolol. Dosage, adult 50 to 100 mg daily as single dose. Children not recommend for children. Mechanism of action. Atenolol is a beta adrenoceptor blocking drug that is beta selective, acts preferentially on beta adrenergic receptor in the heart. Selectivity decrease with increasing dose. Storage. Store in a dry place, protect from light below 30 Celsius. Adverse reaction: bradycardia, heart failure, deterioration, postural hypertension, associated syncope, cold extremities, confusion, dizziness, headache, mood change, nightmares, psychosis and hallucination, sleep disturbance, dry mouth, G1 disturbance, purpura, thrombocytopenia, alopecia, dry eyes, psoriasiform skin reactions, skin rashes, paraesthesia, impotence, bronchospasm, visual disturbance, hypersensitivity reaction. Functional: atenolol is in a class of medication called beta blockers. It works by relaxing blood vessels and slowing heart rate to improve blood flow and decrease blood pressure.
Assalamualaikum, saya Muhammad Naim. Hari ini saya akan membentangkan tentang ubat Omacur. For indication, Omacur is used along with a low fat and low cholesterol diet to lower very high triglycerides fats in blood. For the active ingredients, Omacur contains the active ingredients such as omega-3 acid ethyl ester 19 includes EPA and DHA. For inactive ingredients, Omacur capsule had alpha tocopherol. For capsule shell, it has gelatin, glycerol, purified water, medium chain triglycerides, and lecithin soya. Direction use: the daily dose of Omacur is 4 grams per day. The daily dose may be taken as a single 4-gram dose for capsule or as a 2 grams doses to capsule given twice daily. Seperti yang anda nampak, ini merupakan ubat Omacur yang saya terangkan sebentar tadi. Omacur mengandungi 1000 mg dalamnya dan ia mengandungi 28 soft capsule dalam Omacur.
Okay, hi, Assalamualaikum. My name is Nur alias Rega Binti Muhammad Yusof. Okay, now I choose this acetate for drugs cardiovascular. So generic name dia enalapril. Indication: high blood pressure with the alone in combination with other antihypertensive drug, especially diuretic. Active ingredient: enalapril, millit 5 mg and 20 mg. Doses: the initial dose is 10 until 20 mg depending on the degree of hypertension and is given once daily. In mild hypertension, the recommend initial dose in 10 mg daily. For other degrees of hypertension, the initial dose 20 mg daily. The usual maintenance dose is 120 mg tablet taken for once daily, once daily. The dosage should be adjusted according to the needs of the patient to a maximum of 40 mg daily.
Okay, this is inactive ingredients of acetate. Acetate contain 5 mg, 10 mg or 20 mg of enalapril millet of as the active ingredient. Inactive ingredient is lactose monohydrate and sodium bicarbonate. Side effect is diarrhea, loss of appetite, nausea, dizziness, and heartburn and stomach pain.
So yang ini ubat ni dia letak dalam kotak And then dia ada macam seal ubat. Dia ada yang ni kita orang ambil yang 5 mg. So kita tak dapat yang untuk 10 dengan 20 mg.
Hi, my name is Nur Farouda. Calcium dobusilate. The indication is oral. The active ingredients is calcium salt of dobusillic acid. Inactive ingredients capsule cork, alpha tocopherol. The dosage is dosium 500 mg capsule, created on 23 July 2015. The commercial packaging is first tablet or capsule. These are the most common form and are available in different dosage, typically ranging from 250 mg to 500 mg per tablet or capsule. The packaging usually includes blister pack or bottle containing a specific number of tablets or capsule with instruction for dosage and administration. Second, oral solution or syrup. In some cases, calcium dobusilate is formulated as an oral solution or syrup, especially for patients who have difficulty swallowing tablets or capsule. That's all.
Patient, nausea, diarrhea, skin rash, fever, headache and vertigo. Functional, low visibility and restore normal blood flow. Ubat untuk memompat calcium dobusilate. Gangguan peredaran darah peripheral. Dewasa 0.5 1g setiap hari dalam dos dibahagikan. Boleh juga diberikan secara rektal dan buasa. Kontraindikasi hiperestatif, kehamilan dan penyusuan. Bahagian kanan ubat untuk 500 mg.
Hi, my name is Nur Ashikin. Apart from the cardiovascular drugs that have been mentioned earlier, this is the fifth drug of cardiovascular is amiloride. And for the brand name, we call it as diuretic. And for the indications, it's for hypertension and congestive heart failure. And for the adverse in terms of cardiac disorder, is angina pectoris, palpitation and chest pain. And the dosage congestive heart failure and hypertension for adult as adjunct to thiazide or loop diuretic to conserve, initially 2.5 mg daily, may increase gradually to a maximum of 10 mg per daily. And the active ingredient that has in amiloride is amiloride hydrochloride, and the function of amiloride hydrochloride is potassium sparing diuretic that block sodium reabsorption in the kidney, leading to mild diuretic effect and potassium retention. It used to treat conditions like hypertension, heart failure, and edema while preventing low potassium level. And for the active ingredient is calcium phosphate. Calcium phosphate is for the function is cell functioning and play a vital role in many different body processes, including bone growth and energy production.
Commercial packaging, amiloride tablet strength usually available in 5 mg tablet packaging. Often comes in blister pack or bottle with quantities vary from 30 to 100 tablets per package. Combination number 2, combination tablet amiloride is also available in combination with other diuretics such as hydrochlorothiazide in fixed dose combination. Strength, this combination tablet may contain, for example, 5 mg or amiloride and 50 mg of hydrochlorothiazide. Packaging typically in blister pack or bottle with similar quantities as single ingredient tablet.
This is amiloride. This is available strength for 5 mg. Why is 5 mg? Is depend on the patient that the doctor is depend on the patient that should take how many mg that
they should take. And that's all for amiloride drugs.
Okay, so the conclusion is the cardiovascular system and the hematopoietic system are essential for maintaining overall health and function. The cardiovascular system, including the heart and blood vessels, is responsible for circulating blood throughout the body, delivering oxygen and nutrients and removing waste products. The hematopoietic system, mainly located in the bone marrow, produce blood cells such as red blood cells, white blood cells, and platelets, which are vital for immune defense, oxygen transport, and blood clotting. Together, these systems ensure that our bodies are well nourished, protected, and capable for repairing and maintaining homeostasis. Their proper functioning is crucial for sustaining life and health. So that's all. Thank you.